It is my pleasure to welcome you to this facility's opening, but also my pleasure to introduce Dr. Phil Oswa, the President and Chief Executive Officer of Montefiore Medicine. In terms of an introduction, Dr. Oswa is an accomplished clinician researcher who has been funded by the National Institutes of Health. He's a distinguished educator who has won national awards. He's also a healthcare administrator who is listed as one of the most influential healthcare executives in the country. But the most important thing to know about Dr. Oswa is that he's a pediatrician. And as a pediatrician, Dr. Oswa understands children and the importance in investing in children. So we're so happy to have him here today. Dr. Oswa, welcome back to the Children's Hospital.
Thank you. Thank you very much. I'm not supposed to have any favorites. And that's my story. And I stick to it. But really, it feels great to be back in CHAM. Look, I came as an intern in the summer of 1989 and worked in Northwest 5 and Northwest 6 and NCB Hospital, 18 years in the South Bronx as a community doctor, and many, many years in this place from its beginning. And this is indeed a special place. And what makes it outstanding is the people, all of you, the people who are here, and the sense of collaboration of everybody focused on the patients and the families and on what is best for patients and families and communities. No better example of that than the Links program, among many, which is this amazing place with a focus on ensuring that young patients with a whole array of difficult challenges have access to the world's finest doctors and specialists and healthcare professionals, multidisciplinary teams under one roof. I wanted to tell each of you that's involved with Links and CHAM that you should take pride in what you do. You're meeting young people and children where they are. You're addressing the unique needs of this community, and you're allaying the fears faced by patients and families. You help ensure that every child deserves not just to live, but to thrive. You heal young bodies, and you nurture the future. I feel very close to this place, and it holds a special place in my heart. Not just because I spent nearly 3 decades here, but because, as Nelson Mandela said, there can be no keener revelation of a society's soul than the way it treats its children. And each time that all of you walk through those doors, you bring those words to life. And so I came because I wanted to let you know how much I appreciate what you do. I want to let you know how grateful I am for the work that you do here. And I wanted to let you know how proud I am of what happens in our child health services. And I wanted to thank you for all that you do and thank you for the way in which you do it every day. Thank you.
Pediatrics is an exciting field, but the really exciting things in pediatrics happen when pediatricians collaborate with other specialties and other disciplines. It's my pleasure to introduce Dr. Matt Bartels, the chair of the Department of Rehabilitation Medicine.
And I look forward to us providing more and more services and hopefully being able to help heal and bring better quality of life to all of these children so that we can actually show that, like Nelson Mandela had challenged, we actually rise to the challenge and show that we're the best of what we can be. Now, I get to introduce our next speaker, and it's going to be Peter Semchek, who is our Regional Senior Vice President for the New York City portions of Montefiore Einstein.
Dr. Oswa, thank you so very much for not only supporting us today, but supporting us always. It's always wonderful to see academic departments work well together. And some of the most important accomplishments that we've had here at Montefiore are when clinical people come together around a common cause. In this case, rehabilitation medicine partnering with pediatrics, doing something meaningful for our LINCS patient population and their families, and building the only outpatient pediatric rehabilitation program in the borough. I think that speaks volumes about the commitment that we as an institution have to the needs of this particular community and this patient population.
For great children's hospitals, one of the things that are constant is actually change. Great children's hospitals evolve, they adapt, and they change over time. When the Children's Hospital at Montefiore was opened in 2001, the epidemiology of disease that kids faced and the therapies that we could offer kids at that time was very different than what it is today in 2024. Kids today in the Bronx need outpatient rehabilitation services. It is part of our commitment to that constant evolution, change, and adaptation that makes us a great children's hospital. Thank you so much.